COVID-19 cases are on the rise in Nevada. We're talking with health and state response leaders today on Nevada Week.
Support for Nevada Week is provided by Senator William H. Hernstat, Cashman Equipment, and additional supporting sponsors.
Following 4 weeks of increasing COVID-19 cases, Governor Steve Sisolak has ordered all Nevadans to wear face masks in public. He has also tabled any discussions of moving into Stage 3 of Nevada's reopening plan. With the 4th of July holiday right around the corner, we discuss how you can celebrate while staying safe. Plus, we speak with both regional and state officials about state testing and contact tracing efforts. For all this and more, we are joined by Dr. Michael Johnson, Director of Community Health at the Southern Nevada Health District, Caleb Cage, Director of Nevada COVID-19 Response, and Julia Peak, Deputy Administrator for Community Services at the Nevada Division of Public and Behavioral Health. Well, Dr. Johnson, thank you so much for joining us. We really appreciate always having Southern Nevada Health District on. I wanted to ask, Southern Nevada, as we're preparing for the July 4th holiday right here, we're seeing, to the layperson at least, some alarming increases in some of the main indicators. Across the board, we're seeing increases, some more dramatic than others. But I want to ask you specifically from a public health perspective here, what is the data really telling us?
Well, you're right, and thanks for having me. It's good to be on your show. What we're seeing actually as of today is we have in Southern Nevada 11,481 cases. This is an increase of 295 cases from just the day before. And we continue to see increases in daily cases now for several weeks. So this is very concerning. Most of these cases, the case increases that we're seeing, are really a function of a few things. One, we have an increase in community testing that's been, implemented statewide and rolled out. And the Southern Nevada Health District, along with a number of community partners down here, UMC, UNLV, and others, are doing strike teams and large community pods to offer testing to individuals. So increased testing, the more you look, the more you find, is one of the factors. But there are others, and the reopening of Nevada and several mass gatherings just over the last several weeks that have occurred, such as Memorial Day weekend, the protests around George Floyd's deaths, and so on, have also created an opportunity for more disease transmission. So I think we're seeing both increased testing and a lot more community disease transmission going on.
And one of the ones that jumps out to me, at least, as a significant jump is our test positivity rate. Of course, this is a test widely accepted as being probably the most accurate indicator of where we are with scope and severity, which does compare number of tests over how many of those tests have become positive. Just today, at time of recording, we are over what the World Health Organization maximum limit is of 10% for the 7-day moving average there. Is this something, should we be really, really concerned about this right now, Dr. Johnson?
Well, right. I mean, cases are one thing, and they are very sensitive to testing, as I mentioned, as well as other factors. But the positivity rate is also one of the other really important indicators that we keep an eye on. For several weeks, we had been around 5%, give or take, positivity rate. And you're right, the World Health Organization has set the bar at 10%. And now we're jumping over that. So that is very concerning. Part of that is a function of testing and finding more positive cases, but that is concerning. There are a couple of other indicators that we look at daily as well that are very important, and that is hospitalizations and hospital capacity, which as well as death rates or mortality related to COVID-19. Now, regarding hospitalizations, the bad news is we're beginning to see a slight increase over the last 14-day period in hospitalizations, both suspected and confirmed for COVID-19. So that is a concern. The good news with hospitals is that our capacity is still stable as far as the number of beds available, ICU beds, and ventilators available for people. So that's important. And our death rates have not, we've really not seen any spikes in those. We've seen, 1 to 2 to 3 cases a day as far as the number of increases. But those are ones that we watch very carefully too.
Dr. Johnson, you already mentioned some of the reasons we might be seeing these upticks. Memorial Day, you mentioned, of course, the reopening phases, the protests itself. Beyond that, do we have anything specific that we know is maybe more of the cause? I mean, our two biggest tenets right now, social distancing and wearing of face masks, are we not seeing the practices in place through reopening and in protests and across the board that might be leading to these numbers?
I'm really glad that's a great question. I'm glad you asked it because that is what we're beginning to see. We're seeing, especially among younger adults, we're seeing a lot of them at many of these mass gatherings and protests and so on. And as a result, we're seeing increases in cases in 20 to 30 and 40-year-olds that we weren't seeing earlier in this pandemic. I think another thing to keep in mind is we are in the midst of a pandemic, as I mentioned, and it's not the time to throw caution to the wind and become complacent or think that this thing is over because resorts are opening, casinos are reopening, and other businesses are reopening. There's been a lot of observations within many of these businesses, as well as a lot of anecdotal reports, of course, around people not wearing masks. So, our message has been consistent throughout and consistent with the CDC's that now and certainly going into the 4th of July weekend, people really need to wear masks to protect not only themselves but others, to social distance, which is 6 feet or more from people, and to wash their hands or use hand sanitizer, and certainly stay home if they're sick. The other is with all the increased community testing, we would highly recommend, if you haven't been tested for COVID, to get tested.
And Dr. Johnson, let's talk about some of those measures more specifically. If we are to see a much larger spike in July 4th that might be akin to maybe what we're seeing in Arizona right now, we're seeing dramatic increases in the number of positive cases. What would that mean for the public health system here in Southern Nevada? And maybe we focus first on just the burden on the healthcare system to start off with here.
Well, I mean, we keep a very close eye on the hospital capacity every day. We get reports from the Nevada Hospital Association on their capacity throughout the state as well as here in the South. We don't want to see that capacity stretched. We could be in very dire straits if that happened, as far as being able to provide medical care to those who need it most. So that's a concern. Also, with an increased spike in cases and people not following social distancing and wearing a mask, the most vulnerable populations in our community, that, for example, people 65 and older, certain minority race ethnic groups, and certainly those with underlying medical conditions such as heart disease or diabetes or lung disease, are put at even greater risk. So people need to keep that in mind, that it's not just about themselves, but it's about others.
And you would envision, if I'm hearing you correctly, that if we do see spikes, the disparities you mentioned, especially in some of the ethnic and racial groups that we're seeing, much larger disparities than that are the normal ratios in those demographics, could potentially widen even more so.
Absolutely.
Yeah.
Absolutely. Yeah.
Let's talk. You mentioned social distancing and face masks, of course, is at the top of mind in what we can do. But let's talk about more specifically here. Moving into July 4th weekend here, group gatherings, a lot of travel, both in and out of state, a lot of that by automobile, close quarters of people that you might not have spent a lot of time with that could potentially be positive. What are some other things we should keep that are top of mind as we're kind of planning what our plans are for July 4th?
Well, I think, you want to, wear masks when you're out in public. That's important for people to keep in mind, and social distance where you can. If you're in a car with others that you haven't been around, I would recommend wearing a mask because it's difficult to social distance in a vehicle. As far as mass gatherings are concerned of any sort, whether they're family or in the community or whatever, I would caution people to make sure that you can have at least 6 foot distance from other individuals in these mass gatherings. If the mass gathering doesn't lend itself to that, I would recommend not participating in that kind of a mass gathering, because again, this is how the disease is spread.
And Dr. Johnson, you mentioned testing. Let's talk a little bit more about that. At time of recording, there will still be time to get a test and get those results back prior to July 4th. Do you recommend doing kind of a pre-test even if you have no symptoms at this stage?
Well, we do. We have both symptomatic and asymptomatic individuals, those with no symptoms, that are coming in to get tests. So we have on our snhd.org website a number of COVID-19 resources, including a calendar of all of our testing sites that SNHD is the lead on, as well as all of our community partners. I mean, this disease, we've learned a lot about it. We continue to learn a lot about this disease, this virus, as the days go by. And early on, a lot of the testing was simply for symptomatic individuals and those who were actually really sick, which I think led to higher mortality rate estimates of this virus. I might also add to this is that upwards of 80% of people who do test positive for COVID-19 oftentimes aren't even aware they had it, or they have very mild symptoms or a mild case of it. So it's important to get tested.
Yes, and to close, a great point, not only to contain the virus for the testing, but also for the investigative purposes here so that we understand more specific characteristics of the virus here within our state. Very, very
Absolutely.
Great point. Dr. Johnson, thank you so much for your time. We really appreciate it.
Yeah, thank you. Thank you. Appreciate it. Thanks, Kip.
Caleb Cage and Julia Peak have been working side by side to ensure Nevada reopens safely. We sat down with them for a more in-depth discussion on testing and contact tracing. Well, Caleb, Julia, thank you so much for joining us. We very much appreciate having the state as part of this conversation. We just talked to Dr. Michael Johnson, Director of Community Health at the Southern Nevada Health District. And we talked a lot about the basic precautions here, social distancing and the wearing of face masks, of course, being two of the top priorities. But we also did talk about testing as being one of the main strategies in containment in Southern Nevada. And Caleb, I wanted to talk to you more specifically about the testing, and maybe you can provide some additional context on why testing is so important beyond the obvious reasons of gauging scope and severity of the disease itself, but maybe some other reasons why it is important to the state's response, both short-term and long-term.
Well, thank you, Kip, and thank you for the opportunity to address this important subject here with your viewers. Testing is a critical part of Governor Sisolak's reopening plan, Nevada United, a roadmap to recovery. And that's for several reasons. And I think most important, it gets to providing data that we can use on a strategic level in order to make sure that we're making the policy decisions that need to be made in order to make sure that we are managing this virus and this pandemic here in the state of Nevada as effectively as possible, but also very much at a sort of operational and tactical level where that data goes to organizations like my colleague Julia's or the Southern Nevada Health District, and where they can conduct contact tracing and actual interventions and stop the spread of the disease directly. So, right now in the reopening process that we're in phase 2 right now, Julia says it very well. I don't want to steal her thunder, but I will in this instance here. Right now, we're using the testing and the data from the testing to determine what the new baseline is, what our expectations should be as we move into this phase of reopening.
Well, Julia, let's not steal that thunder then. Let's talk about testing as a major component of contact tracing and contact investigation as well. Same question to you. Why is contact tracing, first off, so important to short and long-term state response?
Yeah, well, let's talk about the process then. So in infectious disease, the way public health gets triggered is a test. And so related to COVID, when an individual goes and gets tested at their clinical provider or at a community testing event, that information is required to go to a public health entity. that information triggers action on our part. And so the first thing that we do is we get a positive lab report, and then we assign it to a disease investigator. That disease investigator is going to call the individual and understand how we got here. Why did they get tested? Did they feel like they were exposed? Did they have symptoms? How did we arrive here? And then we talk about when they were infectious, and we walk through the process of who were you with that could have been exposed, and what other factors might be happening for this individual. So what's your occupation, and is your occupation a risk factor to you? Were you going out in public settings and that was your exposure? And so what we're doing now with the case investigation is adding information in there that can better help us target where we're seeing an issue. Is it in indoor settings where people are not using masks or social distancing? If so, how do we reduce the risk for the individuals in that setting without closing that setting entirely? And so in this scenario, we'd go and we'd talk to the case about who could have been exposed. And what we're using is CDC's definition of close contact, and that's within 6 feet of the individual in a period of 15 minutes or more. Case investigation can be really difficult because the point at which that person was infectious, that could have been last week, and it's really hard to recall everybody you interacted with, especially if you're out and in the environment working and no longer staying at home for the most part. So your exposure could be great. A recent study I saw that came out said on average it's 13 people per day. So just put that in context. Which 13 people did you talk to last Tuesday? And that's, at least for me, almost nearly impossible to recall. And so that's a limitation of traditional case investigation. We do our best with the case to identify those people. And then we reach out to those people and say, you've been exposed. And so we're going to need you to quarantine for 14 days since that date of exposure. And then at some point, we'd like to get you tested. And typically that's going to occur 5 to 7 days after the point of exposure so that we know the test will give us valid results. But it's critically important to make that process as short as possible because, as you can imagine, that individual exposed people who exposed people who exposed people. So the sooner we can stop that ripple effect from occurring, the more effective we are.
Oh, do we have, I know contact tracing and the case investigation is relatively new. This isn't, it's something we do with public health, but with the COVID cases, this is something we're still in kind of a ramp up phase here. But do we have any understanding of any specifics here, any specificities in how the disease is maybe being transferred or being communicated more so than others? Of course, we've all seen the pictures in the casinos of maybe not honoring social distancing and not wearing face masks, but have we been to localize anything specifically on how the disease is being transferred more so than it's not?
Yeah, so like you said, we know how to prevent it. Wear masks, social distance as much as it's possible. Where we're seeing the cases is when that does not happen. So for whatever reason, the person's not social distancing and not wearing a mask. So it really is those two intervention points that have proven to be most effective. The usage of both of those two things has caused what we're seeing today. So we need to address really those two things and just share that with our viewers, is that individual behavior of social distancing, though may be awkward in the moment, in that you take a step back. If they take a step forward and you really honor that space, that might be awkward. But the result of that distancing could stop that exponential increase in cases that I described.
Now, Caleb, in addition to not honoring social distancing and face masks, of course, we have seen a lot more group gatherings over the last month or so. Memorial Day, of course, phase 2 reopening, the protests, the civic activism that we've seen as well. Do we have any predictor or indicator here statewide of what we might see post July 4th as far as what some of our spikes might look like?
So it's a great question, and I think it's safe to say it's one that we are asking ourselves every day, not just with respect to the 4th of July, but with every aspect of the reopening. The first of this month, June, the governor began the reopening process. June 4th, we started to see resorts and casinos in the state reopening as well. And we've gone from a trough of a positivity rate trough of 5.2, and it's climbing right now. That's going to continue, and I'll go back to what I said before, we're trying to find the new floor. We're trying to find that new average that we can then take better control of. So as far as predictors are concerned, it is all about the individual behavior. The virus is going to spread from person to person, and in spaces where people are gathered together, or where there's not good hygiene and social distancing and mask wearing going on. So we can continue to have some of the reopening we've been enjoying over the last month, as long as we are practicing those good social distancing and mask wearing and other behaviors.
Does the state recommend that all people, whether you are experiencing symptoms or not, are getting tests right now to potentially see if you're positive prior to the July 4th weekend?
I think that any time that we see people who are getting out of their immediate social network, or getting out of their homes, or the people that they're socially distanced around and those sorts of things, we would recommend that individuals get a test to see if they're positive. And if they're positive, they take the steps to self-isolate and quarantine and stay home, or seek medical help or otherwise. Definitely want to isolate between the period of taking the test or having the sample collected and having the results from that test as well, because the test is really just a moment in time, a snapshot of that moment in time, and you can go on and be infected after that period as well. And so this is something that I think for the most part throughout the state we've encouraged symptomatic and asymptomatic testing. We've done that through policy. We've done that through funding. We've done that through coordination and relationships. And so I don't see a downside if you can get tested, if you are showing symptoms, if you believe you've been in contact, and especially if you've been contacted by a contact tracing team or disease investigator to go and get that test and find out. These are the sorts of things that we can do as individuals in order to help us responsibly reopen as a state and stay open.
So not only before, Julia, please go ahead.
I would just add that if we spoke about the opportunities for the virus to spread, which is you've not been using a mask and you've not been social distancing. If you know that's been your reality and you plan to attend an event on the 4th of July, testing is critically important for you. One of the things that we see with COVID that is so hard is that you do have a period, either you're asymptomatic entirely, or prior to having symptoms, you're still infectious for a few days prior to that. And so you could have exposed people prior to being symptomatic.
Now, Julia, I want to talk more about contact tracing and the recommendations here too. Of course, we can sit around and wait for that phone call, maybe for somebody from one of the contact tracing groups to contact us if we have been exposed. Our viewership is a lot more proactive than that. So I have to ask, what proactive measures can we take, going back to what you had said at the beginning of the segment here, that it's hard to remember on Tuesday how many you had. What are some of the things we can do to make sure that we are tracking who we are talking to? Is it just jotting that down on a daily log potentially?
Yeah, and honestly, that's the method I use. I would calendar the item, and then I know who I was at a certain meeting, or if we went to a certain event on the weekend, who was around me. So for this particular opportunity, it would be the 4th of July or that weekend thereof. And so that would be your exposure period. And so what we would recommend is if you, again, were uncomfortable with the event that you attended, we would recommend, and our contact tracers would tell you, for 14 days since that exposure, you need to quarantine yourself. So whatever you need to do for that period of time to work, or if you need social services, to understand that that is a way you're going to protect yourself and your community for that 14-day period. As well as I mentioned earlier, you have the option to go get tested. You wouldn't get tested the day after the exposure. The test would not be as reliable. So you're going to wait a period of time and then go get tested and see what those results are. As well, again, if you would attend an event in real time, if you're uncomfortable with the number of people there, not social distancing, to protect yourselves and those around you, just remove yourself from the situation or find an opportunity at the event to social distance yourself.
Caleb, really quick, we're just about out of time. I want to talk a little bit about capacity here and testing, not only that we can potentially provide all the testing past 4th of July, but also that we can do the quick turnaround of what Julie is talking about, extremely critical to the contact tracing part of this. Do we have enough capacity here in state, potentially, if we saw, let's say, double the amount of tests that we're doing right now?
So I think that everybody who's a part of the response effort in the state of Nevada wants increased capacity in all three aspects of the testing effort, and that is the collection, which we're seeing at the community level, the testing, which is being done by public and private labs in the state, and the contact tracing. All of those have grown exponentially, extraordinarily over the last few weeks and months as we've been engaged in this process. And I think we all expect that that capacity continues to grow. What I can tell you is right now we have the capacity we need, and we're on a very good glide path to continue to build and expand that capacity.
Good to hear. Well, thank you. We're out of time. We thank you, Caleb, Julia. Thank you so much for being part of our conversation, and have a wonderful July 4th yourselves.
Thank you so much.
Thank you.
Thank you for watching this week's episode of Nevada Week. For any of the resources discussed on our show, please visit our website at vegaspbs.org/Nevada-week. You can also always find us on social media at Nevada Week.